Now we move to the second talk, which will be presented by Professor Jonathan Zhu. And the title is Evidence-Based Evaluation for Responsible AI. Professor Zhu received his bachelor and master degree from Fudan University and a PhD degree from Indiana University. He was a professor at University of Connecticut, and now he is a chair professor of City University of Hong Kong. And he teaches computational research to social science students and social science research to data science students. His current research focuses on the use and effects of social media based on a mix of observational and experimental data, coupled with explanatory and predictive models. He has published across a variety of fields, including communication, information science, and library science, computer science, and medical informatics. He's a fellow of International Communication Association, among other engagements. Let's welcome Professor Zhu.
Thank you. Thank you for this opportunity to share my views or some of the experiences with AI research. I think in general, we have three basic questions for any topic, including responsible AI, including what is responsible AI, why do we need responsible AI, and how to produce responsible AI. I think this forum addresses all these three questions adequately and with interesting talks, including the most previous one. And I would like to add a fourth double question: how to detect or how to test the resulting AI, produced AI, is truly responsible.
Hi, Professor.
This is what I call.
We cannot see your slides now.
You cannot see my slides?
Yeah.
Okay. Now, if that's the case, I think I had this problem yesterday because I turned on the subtitling. Let me switch to use my PowerPoint version.
Yeah, thank you.
Yeah, I had this problem. No, I had this problem, and but I may not be. Hold on.
Yeah, we can see your slide now.
Now, can you see the second page or third page?
Second page.
Three-leg approach for AI to be responsible post-launch.
Yeah.
Okay. All right. It means that well, this is perhaps another example of a counterfactual. Once I add one input, then the outcome changes. What has changed is this is a PPT version, and so there is no Chinese subtitle to it. And well, what I try to add is the fourth question on how to evaluate the quality of AI takes place largely after the AI product is launched. So it's a post-launch kind of stage task. And I think there should be three components or three legs in this process. First of all, awareness. Secondly, evaluation. Evaluation based on evidence. And finally, there should be a more systematic monitoring system. And I'll skip over awareness because this seminar and itself is a good effort to raise widespread awareness of AI to be responsible. And I would like to focus on the next two legs, evaluation and also the institutionalized system. Now, this evaluation, evidence-based evaluation originated from medical research for probably 20, 30 years. Increasingly, medical scholars and also practitioners realized that all medical decisions, starting from diagnosis to medication to even post treatment caring, should all based on evidence. And this is nothing new. All industries, all domains share this view that we need to base our decisions on evidence or data. The two words are largely interchangeable. What medical practitioners and researchers emphasize in this evidence-based paradigm is that even data or evidence are not born equally. Evidence varies in terms of quality, based on the sources of the evidence, the sources of the data that was originally collected. And what I show you is one version of the evidence-based evaluation, which separates the data into 7 different types of quality. The lowest quality is anecdotal evidence, which includes personal opinions, even opinions views from those leading experts, academicians or fellows or seasoned doctors who practice for 50 years or who is the 5th generation of a medical family, whatever. Anecdotal evidence is useful, informative, but carries the least weight in evidence-based research. And better than that is case study, individual cases. And then above it would be the typical cross-sectional survey that involves large population, different category, different segments of the population represent the true diversity of the society. But cross-sectional data have some inherent limitation in terms of the causal inferences that researchers can draw. Then better than cross-sectional survey will be controlled or natural a natural experiment that evaluates things on the real life rather than selected opinions from survey samples. Even better, panel survey that will follow the same individuals over a course of several years, several decades. You probably have seen stories about a panel study carried out by researchers at Harvard University that tracked same individuals for 70 years. And that's probably most representative or the most extensive survey, panel survey. And control experiment, or another word using the terminology of medical practitioners will be clinical trial, which has been considered the gold standard of evidence. But recent years, there have been even more kind of systematic efforts to combine results from control experiments or clinical trials, so-called ensemble knowledge or meta-analysis. And so this is a fairly extensive list of different sources and a different quality of data, and evaluation based on different evidence, different quality should give full consideration to the sources of data, quality of data, and assign different weights to reach a final summary conclusion. Now, in AI industry and the AI academic research, a lot of colleagues will argue that we live with data, we live with evidence, we start from evidence and end with evidence. And this is truly the case, evidence-based production. But what I argue or suggest is that after AI product goes through all the necessary steps of standard production cycle, starting from training data, test, production, and deployment, there should be one more step. It's a post-launch step to evaluate the resulting product. And there are at least 3 differences between the research that's conducted during the production process and the research in the post deployment stage. Number one, the evaluation, the post launch evaluation needs to be done by independent party, by and large, independent party. This is a fundamental principle, I think, in many practices. And for many practical and theoretical reasons, there are visible or unintentional biases to have the original designers and the producers of AI product to conduct the post launch evaluation. Secondly, evidence-based evaluation or post-launch evaluation needs to draw on independent data. Data are collected from different sources or even in different types of nature. As I showed you earlier, there are 6 or 7 types of data, and it's critically important to use different type of data, or in AI industry or AI fields language, we should use all sample test. I think this is a very important but a largely missing piece in the current practice, because researchers in the industry, in academia, and probably some other corners rely on exclusively the same data. Well, different approaches or different individuals using the same data have one obvious advantage. That is, the results could be comparable, right? However, for evaluation purpose, to detect the quality of AI, we need to have an entirely different set of data. Lastly, thirdly, the focus of the evaluation is not on the effectiveness, rather the opposite to it, side effect or negative effect. And this is, again, an entirely different game, and which also helps explain partly why it is not appropriate for the designers and the producers of AI to perform the post-launch evaluation, because different practitioners of different fields have a very different inherent or kind of intuitive attention to different aspects of the same thing. Now let's look at the the medical practice again. To test the effectiveness and the side effects of, say, a drug or a treatment method. Typically, there are 4 stages involved, so-called phase 1 test, phase 2 test, and phase 3, phase 4. And I believe that most of us have seen this term, especially phase 3 test, very frequently in the news these days, right? And now, if you check into what exactly each phase is charged for, phase 1 will pay close attention, exclusive attention on side effects to make sure that this particular medicine or this treatment method doesn't do harm on patients, right? Then phases 2 and 3 focus more on effectiveness than side effects. But now, phase 3 will receive the approval from government administrative agencies. In the US, it's FDA. I think in China or in many other places, there are equivalent agencies, even though using different names. And but the real test of side effects actually starts in phase 4. Now, at the time, the medicine or the treatment that is already on the market, it has been formally used to patients in larger scale, but still the 4th phase is necessary to keep monitoring what really happens to patients in real life in long term, and which may occur that certain side effects are absent from initial trials because of the shortage of duration, but it could be detected later on, and so then that particular product will be recalled or revised or whatever, right? Now, so this practice is a established standard protocol in medical field for several decades, at least 50 years, or even almost over a century. And I don't see this is the case in AI. Of course, in many other non-medical products, but AI is particularly kind of vulnerable or particularly important because most of the products have a hardware appearances than a software component, and the AI is the software part, and the hardware could be a car, could be some wearable device, and the existing quality control or monitoring mechanism doesn't go into the software side. They only look at those products from a tangible appearances, and that makes this post-launch evaluation particularly important. Now, even though it's extremely important and indispensable, I have to say that it's extremely difficult, and it takes a lot of time, much longer than the design and the development, and also expensive, if not more expensive, but at least substantially expensive in comparison to the original development. And that's probably one of the most challenging for the post-launch evaluation. And that is who is going to pay. I will come back, cover this point. And then there are standard criteria in evaluation research. For example, the two most important metrics to look up is internal validity and external validity. Internal validity concerns the effectiveness or even the side effects during the clinical trial stage, which could happen from phase 1 to phase 3, or could happen in AI production stage. External validity would not be able to conduct their own before the product is launched to the society, and so this is the usual case that formal evidence-based evaluation takes place. And another important requirement to make evidence-based evaluation to be expensive and difficult is it requires causal explanation. I know that AI researchers have paid increasing attention to causal explanation, like Dr. Yongfeng Zhang, right, in the previous talk, gave almost extra attention to the explanatory of AI. And then we all share our belief that explanatory research is important, but explanation is difficult and costly. Now, let me just show you one example from recent computational social science on evidence-based evaluation of AI. This is a study on Twitter to study the side effects of actually news recommendations. And also it uses the same logic as Dr. Zhang previously mentioned, counterfactual design. Now, we all assume, or we all have been told that the widespread polarization on social media is largely caused by the information echo chambers. People pay attention, or people are provided information that is consistent with their existing views, right? And so a counterfactual argument would be that if we offer users views of the opposite party, which will help reduce or even to eliminate polarization. Chris Bale and his team members at Princeton, Duke, I think Duke, create this experiment in which they identify a group of Democratic users and another group of Republican users on Facebook, and then they provide information about Republican parties to Democratic users, and they do the same, the reverse to Republican Party. And so they offer different views. And the results shows the opposite to the general belief that by exposing to opposing views will make people even more polarized than less polarized. Now, this, of course, bears all the substantial implications that goes beyond the concern of this meeting. But the message is that you have to go through this complicated counterfactual design to create a environment that doesn't exist in reality. You have to use manipulation and control the experiment to test this possibility, and that's usually not happen in the production stage of AI product. Whereas evaluation researchers could create similar or different designs to make up this. Now, moving from evidence-based evaluation to the institutionalized monitoring system. Institutionalization means the system has to be built into the existing institutional system, and it's not simply just one organization, or it involves all key players, key stakeholders of the society. In particular, I identify four players: AI makers, designers, and developers, and also hardware makers. Right? The AI makers are the most resourceful and also benefit from AI products financially, and so it certainly has not only a responsibility but to make a better AI products, but also contribute to the independent evaluation of AI products. Gatekeepers, these are the government regulators, agencies, and also the more fundamental policy makers. And then there should be a group of independent researchers, including those of us and also some industry organizations. And I assign this group a role called watchdogs. It differs from gatekeepers. Gatekeepers perform at the birth of AI product, give you a license to go to the market, and the watchdogs will look over the lifetime of the product on the market in the population. So there is a difference in time, and also there are differences in missions, and finally there should be participations from the civil society, but particularly those non-profit organizations and the media.
Thank Professor Chu. I kind of remind about talk time.
Okay. Well,
thank you.
Funding models is important. Let me just jump over to say a few words about the role of government. I mentioned government plays a role, but I think the government should play a relatively minimal role. Instead of regulate everything, instead is to look over the distribution of funding and make sure that AI makers share the burden, but leave the evaluation job to independent researchers. And then there are two kind of methods we can follow. One is FDA model that regulates the medication, and it's a gatekeeping role. And then there is a CPA model, which stands for Consumer Production Agency. It's a voluntary basis model participated by consumers rather than government, but it does receive some support from the public sources. And I think the CPA model will work for AI industry better than the FDA model. But I know that around the world, different governments have discussed different approaches. And unfortunately, the prevailing view is to replicate the FDA model. I don't think this would be productive, and it will be sustainable. And to summarize, responsible AI is necessary, but also expensive, and but ultimately, it will be beneficial for everyone, but AI makers in particular. Responsible AI requires attention, resources, and sustainable monitoring, and it takes years. And we should have a fully psychological preparation for the duration it takes. And but throughout this complicated multi-party process, at the heart, it should still be the scientifically collected evidence. Evidence-based evaluation should be the soul and the heart of everything. Thank you very much, and sorry for a little bit overrun.